Good morning, all. Hi, Emily. Hi, Mindy. Hey, Stacy and Rosalie and Ruth.
Morning.
How are you guys doing?
Doing great.
Good.
What other choice is there?
What?
What other choice is there?
Well, I mean, you can complain. Nobody's going to care as much as you do, but
No.
It is grant application submission morning for me, so I will be one less document to upload, and then I'm gonna go crash, I think.
hey, Betsy, Marion,
Morning.
Scott, nice to have you with us.
Good morning. How is everybody?
Good. I think good.
I've looked at that grant so many times, I'm going crazy. Every time I see something new and different.
What grant are you talking about?
The
Homeland?
Homeland Security, yeah.
Scott, have you joined us to help answer questions or assuage people's fears or stuff for today?
Well, actually, Brian, we have an incredible group of folks, and I'm suspecting at this point that we've beat ourselves up with questions, and we're pretty much done. So we're looking forward to maybe a breather.
Okay.
I equate this to like some of the memories of some of the worst homework research projects I had to do in college.
I hope I didn't miss an opportunity. Is this for Federation, Stacy?
The Homeland Security Grant.
Oh, sorry. Okay. I thought when he said, anyway, if Scott was here to answer. I have an employee who got COVID even though she was vaccinated.
Hey,
That's what I'm dealing with this morning.
Serious COVID?
I can't tell yet. She just got it. And at first it felt like a cold, but she's had heart problems. So anything serious, probably. Yeah. Super concerned about her. But this is the first person I personally know that has happened to. And I guess it's a thing now.
Sure, that's the second person I have heard of, although the first people were a couple and a little older, and they got a very, very mild case of it, but it can happen. And she had both, or it was between her first and second shots?
She had both. But like I said, she had a heart attack about a year ago, and it's probably, I don't know what her immune system condition is or what, but her son got it. She has a disabled son who lives with her, and he got it, and then she got it from him. Yeah, it's upsetting though. This whole COVID thing, I mean, every day it's like, oh wait, now we found out this, or I don't know.
Well, it is 2 after, and while Greg isn't able to join us because he has is taking care of a family member with an appointment, we are going to get started. I just want to say, Karen, it's very nice to see you and have you with us. I'm sure everybody saw that Karen is going to be stepping down. Is that the right way to say it?
Yeah, you know, hightailing it in town, who knows, whatever you want to call it is good. I'm not going anywhere though. I will be around and engaged and in conversation with everybody until I can't do that anymore. So just the next chapter, the next step, not going anywhere.
We are glad to continue to have you in the community. And I know also that Rosalie, you wanted to make an announcement, share some information.
Yes, I wanted everyone to know that we've been selected to be a vaccination site with the Pfizer vaccine. And it will be on April 25th, the first dose. So it's a short turnaround, working with, it's in partnership with the Creve Coeur Fire Department, Fire District, Eureka Fire District, and the County Health Department. So more information to be released tomorrow. There'll be a special link. It is not for an individual person. It's like, it's the link. So just spread it around and looking to fill up. We're thinking about 400 to 500. So they said we could provide more, but we were going to start there. So
Is it Moderna or is it Pfizer?
it's Pfizer.
Pfizer.
And
Rosalie?
will you share the link in the chat? You said that there's a link?
I don't have it yet.
Okay.
I don't have it yet, but we will release it. I should send it to someone at Federation. I don't have like everyone's email address and everything. So can I forward it to somebody?
You can certainly forward it to me and I'll take care of it. Looks like Betsy wants the light to be included as well, probably.
Yeah, Rosalie, should I have someone call you or Jeremy?
Me. Call me.
Okay.
Yeah.
Okay.
Rosalie,
I
you
just
used
saw
the word
yesterday-
spread it around when
Yeah.
you were talking about it, and it struck me how we have to how sometimes common language takes on a new meaning at different times.
There you go. Spread
Rosalie,
it
did you say
around.
that? Did you say the 25th?
Yes.
I just saw a list yesterday of things to be aware of from another synagogue that has had one of these. It was a
Yep.
very extensive list, so I'll send it to you.
Yep. So we're very excited and hopefully we will sell out. We're also taking volunteers to actually give the vaccine, even though they offered it to us if we wanted to have people do that from our community, and we'll be sharing it with the Interfaith Partnership. So
Fantastic.
very happy.
Thank you. If there are other questions, we can maybe at the end circle back around, but certainly share the information and we will get it out. I guess since we opened with that, does anybody else have any brief announcements or information they wanted to share? All right, if not, then we're going to get to the main part of today's meeting. And at the end, we actually have a couple of other speakers lined up for the coming weeks, and I'll share that with everyone. So I wanted to welcome Emily and Mindy from the Federation staff. Most of you probably know them both, but we've recently put together, they've put together a presentation on the use of the COVID funds and our response to date. And we felt like it was really important and good information to share with everyone so that, first of all, you knew what was going on, but also as a way, many of you in your organizations have been partners with us or supportive of this effort. And it's important for us to know what we have collectively done with the dollars that were raised since we started this about a year ago. So I'm gonna let them take it away. I just turned on sharing in case anybody was having a problem with sharing as well, their screens.
Thanks, Brian. Let me get my screen shared with everybody. All righty. Well, thank you for inviting us to share this presentation today. I am going to start with an overview of Federation's main role and our response in the community. And then we'll go through a little timeline, and then Mindy is going to share a lot of details about our COVID investments and where those have gone so far. So one of our main roles, as you know, in the community is as a funder. Like I said, we're going to talk in great detail about our COVID response investments towards the end of this. So I'm going to leave those details for later. Another role of Federation is as a communicator. So as a communicator, our website has provided a space for holding comprehensive information about available resources in the community. When Passover arrived last year, soon after lockdown in St. Louis, our website provided information on where and how to get Passover food and Seder kits, and information about organizations who are hosting Passover programming. Also, when summer 2020 was approaching, we helped compile Jewish summer camp opportunities and resources for families with kids. As a communicator, we created one-sheets with community resources to ensure that everyone was aware of the programs and services that you all, our partners, were offering. For example, we compiled information about financial assistance, services for older adults, domestic violence, employment assistance, mental health, and food insecurity. And then we created flyers that could be shared by our community partners, by you all in newsletters and on social media. We're also a convener. As a convener, Federation has been bringing together this group for over a year now. on a weekly basis throughout the pandemic. As a convener and through this group, we're able to maintain a pulse on the needs of our community as they arise. So, for example, early on, the food pantry, and Miriam's here, had to really quickly change their model to be drive-through pickup. And there were lines of traffic down Bower Road. And because we were here talking to our partners on a regular basis, our board chair was able to quickly find some road barricades to help JFS direct traffic. When we learned about common challenges of our partners, we brought them together outside of this group to learn and develop shared strategies to address those challenges. For example, we were hearing a lot of common challenges among our Jewish early childhood programs, so we convened all of the stakeholders with support from a consultant to better understand the challenges and to develop strategies. We were able to immediately provide an investment from the COVID Response Fund to help teachers access rapid COVID tests to ensure less instability in the classrooms. And we're still working with that group to develop some larger strategies for addressing the challenges. So I'm going to go through now a timeline of our response. Just as a quick reminder, March 8th was the date of 2020, was the date of the first confirmed COVID case in St. Louis. On March 17th, we began making community partner check-in calls as part of our first needs assessment. So that meant Federation staff members called and spoke with 69 lay leaders, executive directors, and rabbis from our local community partners to see how they were doing and to let them know that on March 19th, we would be having our first leadership convening. And now it started out as twice weekly, and now you all are meeting once a week. On March 20th, we began calling our older adult constituency. We made about 2,800 calls to 760 older adults in our community. And we know that a lot of our other community partners did the same. Our congregations, JFS called 1,600 older adults in their constituency to check in, make sure they were doing okay, see what we could help them with. On March 23rd, we published the findings of our first completed COVID community needs assessment, which included the information from our leadership check-in calls. The immediate needs at that time included increased concerns for basic human needs, cash assistance and mental health, technology needs for organizations and isolated people, and Passover food. On March 24th, we had our first meeting of the COVID-19 task force, which was made up of our vice chair of community impact, our board chair, the assessment and planning chair and co-chair, the investment and evaluation chair and co-chair, the vice chair of strategic planning, and the vice chair of development. It's important that we brought all of those different people together for our organization. The task force is the group that we've been meeting with regularly to help us with needs assessments to determine where our COVID investments were going and how we would be able to continue to support the community. On April 1st, we hosted a CARES Act community call. This was followed up by providing support to each of you all who were able to apply for a PPP loan. On April 7th, we made our first round of COVID response investments, which was $93,000, all of which was focused on basic human needs, cash assistance, mental health, Passover food, and some staffing capacity to make sure that those basic human needs could be met. On April 23rd, our board of directors approved investing 100% of what was budgeted for community investments. That meant we were able to expedite our investment process to provide stability to our community partners by maintaining some level of funding immediately and to utilize our model, particularly assessing needs and evaluating outcomes to inform additional investments that would take place later in the year. On May 21st, our board approved the second round of COVID investments for $131,000. That was to create a pool of funding to support food security, so organizations who are providing free and reduced cost meals and food to their constituents, as well as $56,000 for technology needs. On July 15th, we published findings of our phase 2 needs assessment, which was included a literature review, 20 stakeholder interviews, an organizational capacity survey, and participation locally in a national study by Brandeis. At this point, it's important to share that most of our colleagues at federations across the country were just starting to figure out how they were going to do their first needs assessment. We feel really proud that at this point we had already completed our second needs assessment and that we were in regular communication with our partners. We were able to provide a lot of guidance and support to other federations to help them do similar assessments in their communities. On August 3rd, we hosted a change management workshop. And then on August 10, we started providing opportunities for our local partners to receive one-on-one coaching from a consultant. On August 20th, the board approved the third round of COVID funding, which was $42,000. This went to cash assistance and more organization capacity building, the scenario planning workshops, one-on-one coaching with a consultant, and some facilitated roundtables. On August 27th, community partners who receive a community impact investment completed another COVID check-in, which was part of our next needs assessment. And we were able to get an understanding of the organization's needs as well as what they were seeing from their constituents at that time. We provided a series of some scenario planning workshops for our community partners, which began on September 14th. On November 19th, our board approved another round of COVID investments for $206,000 to support more food security, additional Chesed fund cash assistance, and support for early childhood teachers. On January 21st, our board approved our JF&A matching fund investments, which went towards food security, cash assistance, outreach, and staff capacity. And finally, and that was January 21 of 2021. And throughout the beginning of this year, we've continued to stay in touch with you all, with our partners, and provide other capacity building opportunities. We launched a mental health and well-being planning process for young adults and have facilitated 3 capacity building workshops.
Good morning, everyone. I will jump in here. Thank you, Emily. It's really amazing to reflect on and to see, and it's really a source of pride for me to know how much Federation has done over the past year related to the pandemic. And we hope you all feel connected and are excited about this, because so much of it was for you and your institutions and your constituents. And all of this is done to preserve a vibrant and thriving and secure St. Louis Jewish community. And this past year really, really was extraordinary. So now I want to focus on our role as funder. Over the past year, we made investments related to COVID from the COVID-19 Response Fund, as well as from other sources. And throughout the pandemic, as Emily said, we've conducted a number of community needs assessments, and we've worked really hard to maintain that pulse on the changing needs of our community and all of your institutions by constantly being in touch with all of you as our community partners. So all of our investments have been made to meet the identified needs, and we can go into some detail. The total that we've raised for COVID-19 is $945,000. And this is made up of $720,000, which was raised through the COVID-19 Response Fund, and $225,000 that we were able to access from the JF&A Human Service Matching Grant due to new and increased gifts at the end of 2020. Many of you and our major donors and so many in our community really jumped in and were so generous with their support. We ended up with almost $1 million for these efforts. So thank you. What an incredible community we have to have accomplished that. The total that we've invested to date is almost $760,000. And I just want to remind everyone here, we use the word investments to talk about grants or allocations into our community. This is aligned with our new model and the idea that this isn't just transactional. What we give to the community, what we give to each of you is hopefully about something deeper. We have invested 80% of what has been raised so far, which leaves about 20% totaling almost $250,000 to be invested in ongoing and potentially new needs. And you've all heard this before. We never intended for the response fund to be used immediately. We knew that the needs were going to last a long time. We specifically did not call it an emergency fund. We called it a response fund. And now we still have dollars to utilize for some of these ongoing needs that we're either continuing to hear about or new needs that might come up. For the JF&A Human Service Matching Fund, these were intended to be invested immediately and based on needs. And we were able to accomplish that because we really were in tune with what those needs were in our community. So looking at the next slide, which you have up there, thank you. The total invested almost $760,000. 79% of that, really the majority, has been invested in basic human needs, and 21% has been invested in supporting the capacity of all of you, of our local community partners. So now we can break down each of those into a little more detail. The total in basic human needs is $592,000. Based on needs identified in our needs assessments, we invested $309,000 in food security. Investments include support to Crown Center, Covenant Place, the J, Nusach Harri, and B'nai Amunah. And some of our partners are providing prepared foods, prepared meals to those in need, while others are providing groceries. And I did not say JFS, which is of course included in that for the food pantry. There was $210,000 invested in cash assistance. Investments include chesed funds for congregational rabbis and additional cash assistance for JFS, which is on top of significant funds that we provide annually to JFS for cash assistance. Additionally, in early 2020, we expedited our regular annual chesed funds to rabbis so that they could know right away that the funds were available and so that they could distribute them to congregants and community members who might need that. We've invested $10,000 in mental health and well-being from the COVID Response Fund for community workshops and increased counseling hours at JFS. And you can see the shaded area here. This is to show that we also invested an additional $52,000 from community investments for a process to develop and pilot programs and services to meet the mental health needs of young adults in our community related to COVID. We're in the midst of that process now. It's really fascinating to see. We're really eager to see the outcomes. We've gone through the first phase of bringing people together, understanding what some of these needs are, testing some of those, and now we're moving into the implementation phase. So you will all be hearing about that soon. In community impact, we talk a lot about outcomes and impact. So I want to share a few with you from these investments. And these data points we got directly from you. And we want to thank you all for your ongoing communication, for your quick responses when we reach out and ask questions about this. It really helps us understand not just what you as an organization are accomplishing, but how we are all coming together and how we're all together able to make a real impact in our community. So for cash assistance, JFS had a 30% increase in financial assistance requests in 2020 over 2019. And JFS provided cash assistance to 119 individuals, 102 of which needed cash assistance more than once in the year. For mental health, between April 1st, 2020 and December 31st, 2020, JFS experienced an increase of 173 requested counseling hours for COVID-related concerns for Jewish clients. And that's over the same time period the prior year. 84 individuals participated in community training and support sessions, and JFS has seen 46 new Jewish clients. For food security, the Harvey Kornblum Jewish Food Pantry saw a 30% increase in individuals served from 2019 to 2020. And the food pantry served 56 new Jewish households and a total of 725 Jewish individuals. Through other partners such as Crown Center and B'nai Amunah and others, more than 13,000 meals have been provided to over 1,000 households with our food security funding. If we look at the total in organizational capacity, that's $167,000 that's been invested in this area. And again, based on our ongoing needs assessment and regular communication with all of our community partners, we invested $72,000 in organization staff capacity and outreach to ensure that our partners had staff to respond to incoming requests, and to make sure that people in our community know about the resources that are available. Specifically, we supported increased staffing needs of JFS to ensure that they can meet the needs of community members in a timely manner, meaning less waiting lists. And we made an investment in the MERS Jewish Community Employment Services Program outreach to make sure that when people are in need, they know about this program in our community. We invested $56,000 in critical technology needs, providing mini grants to 29 organizations to increase their technology capacity early in the pandemic. I know many of you were recipients of those mini grants. It was really quick. We heard your needs. We tried to come up with a really rapid response to be able to meet those needs. And we heard really positive feedback about that. And $32,000 in consulting support. This included providing one-on-one coaching, scenario planning workshops, an early childhood roundtable, and additional capacity building workshops with Nanette Fridman, including collaboration, financial resource development, and lay professional relationships. That last one just took place last week. Looking around, I know many of you participated in one or more of those. And again, we understood that those were the needs that each of you were expressing, and we tried to come up with these programs to really meet your needs. And again, we've heard really positive feedback about those. And finally, $6,000 for early childhood rapid testing. Again, early last year, we heard this was an immediate need from the Jewish ECCs, and we provided funds to help early childhood teachers be able to access these rapid COVID tests for quicker turnaround and less disruption to the schools. And some impact data here. Through our investments in organization capacity building all of our community partners, all of you were able to continue serving the community. And I think this is probably one of the most important things we can say here. Also, 29 of our partners enhanced their technology capacity. More than 40 partners received support from a consultant through participation in these workshops, coaching, or cohort gatherings. We could not have accomplished all of this without the generosity of our community. So I want to thank all of you for your support of Federation, and mostly thank all of you for the work that you did during this past year, during these turbulent times, to serve our community. We shall be really proud of what we've been able to do together. So I am more than happy to answer any questions that you might have about our COVID response.
All right, questions or feedback or comments that anybody wants?
I have a quick comment, not feedback. Just from the very beginning, just seeing the picture of the cars all the way around the block, I've been grateful the whole time, but I just want to thank you again. Everything you said, I mean, there were people behind everything you just said, from the extra therapy hours to the food, increased food needs. And it's just beautiful to hear about everything the whole community did. But I just want to thank you at Federation for stepping in right away. I wrote down, for all but 14 of our 175 volunteers at the pantry had to stay home for their own safety, and we couldn't run the pantry until you stepped in and provided money for staff to come in. And then we built up, because of this incredible community. We have more than 300 new volunteers now who work at the pantry, and we didn't need it after a few months. But I just want to thank you. That's all I have to say.
Anybody else? Any questions or thoughts? Okay, well, thank you, Emily and Mindy, as well, not just for helping to lead the needs assessments and so many other parts of this, but also putting together and sharing the information. For me, the reason why I wanted us to have the opportunity to talk about this and do this is because we've all just been through a really, some might say traumatic, but certainly unique year. And while we were in it, we were all making decisions and doing things as quickly as possible to help those that we're here to support. But at some point, we have to be able to step back and look at what was done very quickly in a relatively short amount of time and be able to learn lessons from it, but also feel really good about it. And while this is from the perspective of the Federation, as Miriam talked about, none of this happens just because we as an organization are here. It happens in cooperation and collaboration with all of you and with the broader community. And we need the opportunity to step back and say, look what we helped make happen at a time of extreme need for people. And there are lots of other examples, and I welcome anyone, right? This is a collective agenda to have that opportunity, but look what we helped make happen as a community, what we helped do. We'll have time in the future to also sit back and say, what are these things that we learned and did? Do we want to take forward, right? For whatever it is, but we should all collectively feel really proud of what has been accomplished. You all have a list like this within your own organizations as well. Please take a moment to pause and look at it and feel good about what happened. So thank you all for your partnership in making this happen. Is there anyone else? Anybody want to add anything or anything? Because we can move on to a next agenda item, which is open. David is very busy at the Capitol. He's not able to join us today. But does anybody else have anything that they want to share or talk about? Well, then I will let you know that over the next month, we have more than a couple of people joining us. A couple weeks ago, when I actually wasn't on, there were some questions about some legal perspectives on reopening and vaccinations and things, I think. And so next Thursday, Kate Copen, a senior associate in labor and employment from Husch Blackwell, is going to join our conversation. Please, if you have questions that you specifically want to ask in advance, let us know. Kate will be on to answer questions and address things as best as she can. Certainly from the legal perspective. The next Thursday, so in 2 Thursdays, we're going to be joined by Dr. Hilary Babcock, who's the medical director for BJC's Infection Prevention and Epidemiology, and also a professor of medicine, infectious disease division for WashU School of Medicine. She's going to talk about a little of the science and medicine around reopening. She's actually advising BJC on their reopening, on what they should do, how they should do, things they should consider. She's going to share some of that with us and then be open to questions. The week after, on May 6th, I'm sorry, what?
What date was that one?
That was in 2 weeks, on Thursday, April 28th. We're going to send something out with all this. I just wanted to give everybody a little bit of information, let you know that you are welcome to invite whatever volunteer or professional staff people to any of these, and we're going to send the information out with the follow-up today on the dates and who's coming, but anyone's welcome to join. On May 6th, we will probably be getting an update on the 2020 community investments from Mindy and team. And then on May 13th, David is going to join us for the majority of our session because the legislature will have finished their session. He's going to do a legislative session overview, talk about not just what did and didn't happen, but things that that some of us might think about considering or be aware of that came out of the session. So we have a lot of people joining us in the coming weeks around a bunch of different topics. We are always open to adding topics. If somebody has something they'd like to see, we'll do our best to do it. But we will get that information out to everyone. Thoughts, questions, other things people want to talk about or bring up? Well, look, it's beautiful outside.
Brian,
Oh, yeah.
I have a real quick one.
Yeah.
Do the people who aren't on the campus, do you publish your address? Is there a security concern with publishing your address?
Scott, any thoughts? Karen?
Well, I mean, I'll just make this comment from a practical standpoint. You know, many of you need to be able to get people to your location, and they don't often make a phone call to the organization to ask for the address. They sometimes just look that up. So I think from a practical standpoint, it would be difficult for many organizations not to put their address information out there. I know the Jewish Light had was basically not putting out a specific location for a long time. I don't know, Betsy, did you change that?
No, but we're moving off the campus and I don't really want to, but there's, I just think sadly, in this time, the fewer people that know where anybody Jewish is, I mean, that's horrible, but I'm just trying to see, am I being paranoid or because we don't really have people that come except for if we invite them, the mailman.
I think, Karen's has for many, many years not broadcast their location. And they just provide, when they're going to have a meeting, they just provide that particular individual with the location. Karen, you want to comment? I mean, and I would agree with that process. For you.
I think being on campus or off campus, I think the Jewish Light is a perfect target, symbolic for a lot of reasons. And I think you might as well just keep high levels of security. And Scott can obviously advise when you're going to your new location, all the assessment stuff he can do. But yeah, I would be just as vigilant.
Okay.
Yeah, that's the model that I would tend to use for your specific operation.
Yeah.
I think other operations would have a difficult time doing that, but you are very high profile. You obviously editorials, those types of things, stories that come out in the paper. And like you said, it's not a walk-in operation.
No, thank you. Scott, I'll probably reach out to you. I also just want to publicly thank Mindy and Emily because the funding we have gotten through you all this year has been a lifeline, and you have personally both been very helpful to the Light, so thank you. And it's been a great experience. I also just want to put it out again. We're always looking for news about Jews. If you guys have anyone in your organization that is getting promoted or any of your clients making amazing progress or anything like that, we're trying to do more and more and more about people and what the Jewish community is up to and how wonderful we are. So send them our way.
Thanks, Betsy. Anyone else? All right, so we are going to get out. Rosalie's going to get the information about their being open, their clinic, or their providing vaccines. We'll make sure to get that. I'm going to make sure that we get the information about our next couple of weeks. Speakers coming to us. If anybody has a thought about either a speaker or a topic or something that they'd like to be adding to the agenda or to talk about, please don't hesitate at all to reach out. Yeah, and thank you all, really thank you all for everything that you're doing. I know we often worry about our staffs. Somebody has to worry about us. Please take a couple of minutes this week and every week to take some time for yourself. It's really important that we as leadership are able to help lead our organizations. And the only way we can do that is by having the space and the time for us to process and think and address our own kind of, issues and concerns and own mental and emotional health. So thank you guys for everything that you're doing. Have a really good week.
You too, Brian. Thank you.